most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to cover the top 5 things to do for chronic low back pain. Plus, we're doing a giveaway.
A giveaway.
By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. And if you want to check out the giveaway, go to bobandbrad.com. Go to the giveaway section. We're doing a giveaway contest. We're giving away, and we're going to talk about this, we're giving away an infrared, a Thermotex infrared heating system here. I don't know if you call it a pad, but this thing is awesome. We're going to talk about it.
Yeah, I think you could call it a pad.
Yeah. If you also will find it on Bob and Brad on Facebook, it'll be pinned to the top of the page. If you want a short version of us, go to Twitter or Instagram. We got 60 seconds of Bob and Brad a day.
There you go.
All right, number one, the number one thing you should do. I had a friend, Brad, that worked at a clinic where all they saw was patients with back pain.
Sure.
First thing they have them do is walk, because walking helps create synovial fluid. It helps get more blood flowing. It can help act like a natural balm for the back. It'll actually calm things down.
Balm.
Yeah. Like like the cream that you put on, like a
I got it, Bob. I got it.
Let's say you're having trouble with walking, though. Try this little tip.
Right.
Actually, try walking faster. I had a patient that this worked just beautifully with. He came in limping. He looked like the Walking Dead, looked like a zombie. And we started having him practice walking around the room faster.
Mm-hmm.
It actually unloads the spine a little bit.
And
by then, he's like, he couldn't believe it. He
Sure.
was like walking around like he was having no problem.
Really?
And he ended up doing just wonderful.
Good.
So
yeah, anytime I can have a back patient walk, that's one of their jobs. Although typically say on the flat, don't go up and down hills
Good
or
point.
on uneven surfaces.
Very good point, Brad. That's why I have you around.
Well, yeah.
Keep me honest.
That's right.
Number 2, we are going to recommend that you might want to try far infrared heat. So the reason it's better than regular heat, it penetrates 10 times deeper.
Yeah, it's significant.
Yeah, and we always like to show it on the ruler here. So this side represents regular heat, which is just surface heat, basically.
That little blue mark, if
Yeah,
you can see it.
Regular heating pad.
It's skin deep.
Now,
basically.
Mike, work your way over here, and that shows you how deep far infrared, especially like the Thermotex goes.
Right.
And you can see what a difference that would make. Rather than just heating up the outside surface of your back, it's going down into the joints a bit.
As well as the muscle. The joints, each vertebra has 2 joints, those facet joints, if you will. And you need to get those warmed up and get some circulation in the area.
So, yeah, very good point, Brad. So Brad and I are very big fans of these. We keep these in our chair at night.
Especially, it's January right now in Wisconsin and Minnesota, so you get a double benefit.
Right.
It just is a nice
So
nice
I went
way to read a book.
I went from having it in my chair back here to having it over here on my hip.
Oh,
my hip is
hip issue?
my hip is better.
Yeah.
So now it's back onto the back again. But what's nice about it is you can leave it on all the time, by the way, if you want, because it uses hardly any energy. And
we don't recommend it, but you should turn it off.
They do it at their office in Thermotex. They have one that's been on for 16
Bob,
years.
it's a waste of electricity, though.
Well, 2 pennies a day. So anyway, if you keep it on, what's nice about it, and it's all ready to go once you get on it.
Right.
Otherwise, it takes a few minutes to heat up.
Yeah, they are a little slower initially, but they go much deeper.
Right. And what they recommend for back pain is 45 minutes twice a day.
Mm-hmm.
And you think that's a lot, but you know what? If you're sitting in your chair anyway,
right.
I just keep it on. So it's got straps on it, so I can think that's enough, huh? But for the
Yeah,
giveaway,
better.
by the way, if you use the link below, they give you a significant discount. These are pricey,
Right, they
but
are.
if you use our link, you get a significant discount.
Right.
So, number 3, I want you to get some type of exercise. And what I mean is some type of exercise specific to the back. Because a lot of times if you stretch it out or get movement, you can help decrease the pain levels, maybe even eliminate the pain levels.
Right, but you need to find an exercise or movement that the back tolerates and actually makes it feel better. And we're going to show you 3 samples. You're not going to do all 3 of these exercises more than likely. You're going to find one, maybe two that help it out, and those are the ones you're going to do.
Very good. So the first one is cat camel. Most people can do this one. If you can get on your knees, that is.
Sure.
If you can get on your knees, you're going to go ahead and go in the quadruped position, as we call it. 1, 2, 3, 4. And I'm going to arch up like this. And when I arch up, a lot of times I like to bring my head down like that. And then I'm going to arch the other way. And I'm bringing my head up.
And if you do this and it's pain-free, except for maybe at one end, when it starts to hurt, you just bump into the pain. Don't push into it. Backs are one thing. You do not go with that old saying, no pain, no gain. That's not how you want to treat back pain. You want to avoid irritating it and making it painful.
Brad, I'm going to go ahead and show the third one right away, and that's press-ups. So this one, it works for a lot of people. It's not going to work for people who have spinal stenosis or spondylolisthesis. It works well for the average back, but you're trying to do some press-ups here. And even if you start with baby press-ups here, that'll be just fine. So your hands are underneath your shoulders. You're lifting up without lifting the pelvis. If you're doing this, you're too tight, and you should keep the pelvis down and just work in a smaller range then. But eventually you might be able to work up to this point even. Maybe.
Right.
If you're younger.
Right. If you're younger or depending on your history. But these are really best to be done. The cat and camel, this probably on a carpeted floor. You can do them on your bed. Works better on the floor. Depends on how safe you are to get up and off the floor.
You want to show the last one, Brad? Windshield wipers?
Oh, yeah, it's my favorite.
Sure.
The old windshield wipers. No, that's got nothing to do with your vehicle.
I think you named it, didn't you?
Well, I'm not sure if I can take full credit, but I don't know anybody else who has. But, this is what I tell my patients. You always give them a visual to remember an exercise. So I'll have them go up with their knees like this, with a pillow under their head. You don't have to have them, but it's a little more comfortable. That's all right, Bob. I'm fine.
Got one.
Oh, Bob. I'm glad you care. That's more comfortable.
There
then, if you look at your legs, you put your knees together gently, and then you go back and forth as if they were windshield wipers on a car. Now, again, this is another pain-free motion. If it feels good to go to the right, but you go to the left and it starts to be painful, don't push into the pain. Just go up to it and then go back and forth in a pain-free range. And if you do these, 10 repetitions 3 times a day, over a matter of a day or two, hopefully, and what will probably happen is that left movement that was painful becomes less painful, and eventually you'll get full range of motion both directions, and life is good.
Just I want to show one other thing,
Oh,
Brad.
yeah.
If it hurts like right here, you might try putting your legs a little straighter.
Sure, yeah.
Or you might have them bent a little more.
Yeah.
One of them, it'll change the angle of the back, and it might feel better.
You could even try this.
You could try that.
I haven't had that work very often, but occasionally it does.
And you can also, when you go over like this, even let it stretch a little bit.
Oh, yeah.
So
pain-free, remember? Stretch is okay.
Pain-free is right. We're not looking to make things worse. Number 4, what you're going to try to do is make sure that you're sitting with support. We've become a sitting society, and what is happening quite often is that after a while, especially if you're on your couch or your easy chair, you tend to slump into it. I always have a throw pillow in the back of my chair, along with my Thermotex. On top, my Thermotex is actually strapped to the pillow.
Oh, really?
Yep, and I just put it right there in place. So,
what about this?
All right, so yeah, you can, in order to stop that slouching from happening, that slumping, you can just take a roll towel. We got a little bit of tape on the ends of it, and you can use that. Or like I said, if it's in a couch or a easy chair, you might want to use a throw pillow.
Yes, right.
It's just not enough. This works well in a car or an office chair.
Right.
Depending on how big your curves are, you might have to use a larger one. Once you figure out how big a towel you should use, maybe you want to get something more permanent, like these are a Mackenzie roll. We'll have a link below, right, Mike, on these? So, sure, Mike says. So you can see this one's actually probably too much for me.
Yeah,
I usually like a thinner one like this. My wife actually has this one in the car.
Oh, really?
So, yeah.
Yeah, if you look up, there's a number of different shapes and sizes and how dense the foam is and things.
Some of them are longer, flatter, wider, the whole bit. So you can figure out what works for you. Number 5, you want to learn to keep the spine in a straight safe position, locked in while you're doing all the activities of your day, while you're bending forward, while you're lifting. Brad, can you maybe grab a Booyah stick and demonstrate what I'm
All right.
talking about here?
This is one thing I do with my patients, that they need to keep their back straight. It feels better when it's straight, but they have a lifelong habit of bending forward to pick things up or just slouching forward. If you take the stick and I'm going to hold it so my head touches, my back touches, and my butt or my sternum.
Yep, so he's got contact here, here, and here.
Right. And I maintain that contact in all 3 points, and then I'll have them practice squatting like this. And then as long as all points, as opposed to like this, then we got this, we keep it straight. And it really helps teach body mechanics to bend.
Yeah, it's a great one to do a lot. I actually do these every day. And then I find myself, like when I'm bending, it just jumps right into my head.
Yeah.
The muscle memory.
Right.
And I actually end up doing it correctly. Like, oh, this is a squat. And I keep my entire spine straight. So it's really well worth your while. Besides getting some strengthening of your,
right,
your legs.
Exactly. So you're getting an exercise, you're developing good body mechanics. It's a win-win
By
situation.
the way, for the few people who are still watching, if you can help us name this, we're going to have a contest on Facebook too and stuff like that. But help us name.
It's called the Booyah stick.
I know, but the squat. What's the name of this squat? What should we call it with the Booyah stick? Come up with a name. We have a name for the chicken wing, and we have the Statue of Liberty stretch.
Yeah.
So now we need a name for the squat.
The Booyah squat.
So all right.
BS.
Remember,
Booyah.
Brad, I can fix just about anything
except for
a broken heart.
I wrecked that one.
Yeah, you did. All right. Thanks for watching.